Hi, I'm Dr. Steve Dorn, and welcome to the medical segment of Western Wisconsin Journal. I'm a family practice physician here in Hudson, Wisconsin. And do you know what time it is? Well, it's time for open enrollment. It's fall, getting towards winter, and people who have Medicare insurance, that means over 65, it's time when they can choose their supplemental insurance. And that's what we're going to talk about in the first part of the show today, is you need to get the best deal for you. That means the less money that you can put out to pay insurance, but the best deal, best coverage. And that's not going to be easy. But you should compare maybe at least 2 or 3 different insurances, and there's a ton of them out there. There's UCare, there's Blue Cross Blue Shield, Health Partners. Everybody has a plan, or maybe more than one plan. The first thing that you have to look at in order to try to save money is the premium. Premium is what you pay monthly, and you can just compare them across the board. Okay, this is $120, this is $220. But the premium doesn't mean everything. You have to look at other things like the coverage or some of the hidden payments that you have, like a copay. Okay. Some of the things you have to know about Obamacare and what we're going to do with premiums. 80% of the premiums that you pay to insurance company, 80% has to go to health care. The rest of 20% goes to administrative costs, paying for buildings, overhead, but it also goes to pay dividends to the shareholders. And it also goes to pay money to CEOs. And I can give you an example. Stephen Helmsley, who is the CEO of United Health Group, and one year he made $48 million. That's a lot of money. Is anybody worth paying that much money to? Just think of all the tests and medications that got denied by the insurance company to help pay the CEOs. Okay. So what else are you going to look at? Well, how do you compare the other costs besides premiums and choosing healthcare insurance? All right, another helpful thing from Obamacare is that he said every insurance has to have a summary of benefits and coverage. Okay, so you pay this much money, this is what we're going to give you back. But it has to be very clear cut so that you can understand and compare that to others. It's called the summary of benefits and coverage, okay? And of course, this is another good thing about Obamacare. There may be some bad things, but there's some good things. Another thing you can do is compare deductibles. All right, what's a deductible? In general, for health care, you pay all the costs up to a certain point. For instance, a deductible of $1,000. You'll pay for your visit, you'll pay for your medications, you'll pay hospitalizations, ER visits, up to it hits $1,000. And then the insurance company will start paying. Now, sometimes they don't pay it all at once. They will institute an 80-20 plan, where they'll pay 80% of it and you'll pay 20% of it, up to another certain point. And then the insurance company will pay it all. Well, you need to look at that. You need to see who has high deductibles. And if you're going to be using the health care, which a lot of people do, you might be stuck paying a lot more deductibles. Okay. You have to look and see what kind of coverage they have in terms of preventative care. What will the insurances cover for preventative care? What is that? Medicare is not a good payer. It doesn't pay real well for medications. And it covers one physical when you turn 65. That's it. Nothing. So you have to look at the supplemental insurances to see if they'll cover an annual physical. Whether you need an annual physical is somewhat up for debate, but most people over 65 do because they have health problems and need a lot of screening interventions. Now, do they cover things like colonoscopy screening, mammogram screenings? These are all preventative care. Copays. I think we're all familiar with copays. It was instituted as a way of keeping people from going to the doctor every day for simple problems. There's copays for the ER, maybe $50 for an ER visit, maybe $30 for a clinic visit. Well, if you're going to be going to the doctor, or sometimes you have to go to the ER because you have a chronic condition, then you're going to be stuck paying a lot of copays, and that's going to add up. So you may want to find a policy that has lower copays. The other thing you should look at, and we just talked about it a little bit, is chronic conditions. Sometimes insurance companies won't cover a pre-existing condition. It could be diabetes or a heart problem. It could be a very unusual genetic disease. On the other hand, sometimes they'll put a cap on how much they will cover for a pre-existing condition or a chronic disease. Well, we'll only put out $1,000 for this year, or maybe it's $100,000. All right, if you've got that chronic condition, you have to look at that. How much are they going to cover for that? So you have to know what kind of illnesses you have, and you also have to know what kind of medications you're taking, because you need to compare costs on medications. It's not unusual for people to be on huge numbers of medications, up to 10 of them. Most of them are usually generic and pretty cheap, but others can be very expensive. And how do they cover these medications? If you know what you're on, maybe you can compare across the board for a certain medication. All right, how does this one insurance cover this medication? How does this insurance cover it? All right, is there just a copay for the medication, or are there different tiers? Where's my tier? Is this a tier 3? I'm going to have to pay for it practically outright out of my own pocket, while this insurance over here will say I'll only pay for half the price of the medication. That could be a substantial amount of money, and that might determine which health plan you go through to or get for your supplemental insurance for Medicare. All right. So, in summary, supplemental insurance for Medicare, don't go just by the premium. You got to look at deductibles, copays, cost of the medications. What's it going to do with your chronic condition? They're going to put a cap on it. They're going to limit it. All right. I'm going to change gears a little bit now. And I just added this on this morning. I was reading the newspaper. And I want to talk about ethics in research. I've talked about it before, and it's an ongoing problem. It turns out that there's another Medtronic scandal. This time it's about a medication called Infuse. And Infuse is a protein that causes bone growth. And it's used in a procedure called a fusion. These are for people with severe back problems. And a fusion is where hardware is actually put in, screws and plates, to stabilize the spine. There's fusions at all levels: neck, thoracic, and your lower back. And part of fusions is a part where they put in a bony graft to secure the fusion. But over time, this bone has to grow together. And this Infuse stuff helps it grow. It's good in theory. Now, the first time Medtronic got in trouble with this was their representatives that go out to the spine surgeons and say, hey, not only can you use this for low backs, but you can use it for other surgeries that need the bone to grow. And the FDA, which is the Federal Drug Administration, said, you can't do that. This drug is only approved for what you tested it for low back fusions. So they may have been trying to push it for spinal fusions or who knows what else. Now, I've dealt with drug reps for 23 years, and one of the cardinal rules is if their medication or their device is only approved for one thing, they cannot tout it to be used for other things. Okay, that was $40 million fine for Medtronic, just for that. Okay, now this morning, they've come out and gotten more trouble with this Infuse. And here's the crux of ethical problems when it comes to research. A company invents a product. They want doctors to test the product. The company can't test the product because it might have to do something to do with a surgery. And they could do surgeries on animals, but you really have to test it on people. And people have to realize it's experimental and go along with it. And they usually have a control group that doesn't get the medication or the device, and they have the experimental group that does have the device or the medication. Well, the company that makes the devices has to pay the doctors to do this. And the doctors should be paid to do this, to do the studies. But therein lies the conflict of interest, because the companies put pressure on the doctors to get good results and puts pressures on the doctors to maybe not tell everything that goes wrong, like some certain side effects. And that's what happened in the Infuse study. The first few studies came out, didn't seem to show much side effects. But sometimes Infuse works too good. And sometimes there's too much bone growth in the back. And that is a big problem. All right, what kind of problems have they run into? Well, one of the first one I was surprised is cancer. I'm not sure where that came from. However, the overgrowth of bone can cause male sterility, bladder dysfunction, leg and back pain. Okay. The initial researchers were paid millions of dollars, the physicians, to try this out. And there's concern that the studies didn't tell about all the side effects or the long-term effects, okay? More recent studies that had nothing to do with the manufacturer, Medtronic, they are showing lots of side effects. Therefore, the federal government is doing an investigation, the FDA, into Medtronic in this big scandal. But this is a problem that I've seen, and I don't have a good solution for it. It's just basically medical ethics. A drug company comes out with a medication, they run it through some tests, they pay people to do these tests, and then later on down the line, oh, this drug isn't as effective. Oh, this has terrible side effects. It may even cause death. Okay, look at Vioxx. Vioxx got pulled off the market. It was a special anti-inflammatory pain medication. It turned out to cause heart attacks. But we didn't find out till later, till people were taking it. Okay? And you wonder why the FDA drags its feet when it doesn't approve medications to be put out for people or medical devices to be put out for people. And why are they always like being used in Europe before they're used here? Well, there's good reason, because not always is the truth out there for them to evaluate a drug or a device. How much regulation should go into this? I don't know. Where does the private market come in? I don't know. But let's face it. There are crooked companies. There are crooked people in companies. And there are crooked doctors. We're human too. So if the FDA wants to drag its feet for something that's not super important, I mean, certainly if it's an AIDS drug that cures AIDS, you'd want to rush that along as fast as possible. But so, yeah, maybe they should drag their feet and make sure something is thoroughly tested. Or maybe they should have people test it that aren't being paid by the manufacturers. All right. I'm going to change gears again. This is the third time. I'm going to talk about some recent studies that are a little bit troubling. And they're even troubling for me as a practitioner because they've gone against some of all the practices and things that I teach people. All right. The first one that really gets my goat is there's a study out there that says, oh, you don't need physical exams. Now, everybody doesn't need physical exams every year. If you're under 50 and you're healthy, you could probably get an exam every 5 years. But if your blood pressure goes up, we won't detect it. If there's a skin thing that we notice that's cancer, you may not get it detected. What about getting pap smears? Well, if people are stable, you can get pap smears every 3 years. But what about mammograms? They're every year. Well, you need a breast exam, part of a physical exam. So people still do need physical exams. After the age of 50, we've got to get in there. We've got to check that prostate. Got to check for breast cancer. Check blood pressure. What's the cholesterol doing? Do you have diabetes? I mean, so many people have diabetes. It seems like everyone should get their sugar tested every year. So I think still physical exams are still important for people to get. If you have a healthy 40-year-old, he doesn't have to come in every year. All right, the next study that's concerning is we've used niacin to help increase the good cholesterol, called the HDL in people. And it does help. Bad part about niacin is sometimes it increases people's blood sugars, people with diabetes. But a study showed it did not decrease cardiovascular events. It did not decrease strokes and did not decrease heart attacks. Well, that's a little concerning because we've been pushing niacin for a long time. I'm not sure what to do about it. Most people don't tolerate it because it causes like a warm flushing sensation. Another study that was a little concerning, we've been pushing omega-3 fatty acids, those fish oil pills, telling people to eat fish. Well, that does not seem to decrease cardiovascular events either. So that's concerning. Whether you stop niacin, whether you stop omega-3, you may want to talk to your doctor about that. All right. Here's one that's kind of interesting. A recent diabetes study showed that exercise and calorie restriction did not seem to reduce cardiovascular events, the heart attacks and the strokes. What they did was they had people exercise for just a little bit under 3 hours total per week, and then they restricted the calories based on how big they were. That was probably an average of 1,500 calories a day, and that was one group. And the other diabetic group, they didn't have to be strict on their exercise, and they didn't have to be strict on their calorie intake. Problem with that is, these people are diabetics. They're going to be on medication. You have to control the diabetes anyway. So there's a big factor in there in terms of medications. They're all on diabetes medications. The other thing is, if they have high cholesterol, they're on high cholesterol medications. If they have high blood pressure, they're on high blood pressure medications. Now, these people that did a little more exercise and supposedly decreased their calorie intake, they had the same stroke rate, same heart attack rate. Okay. what I read on in the article, I didn't make me very happy because I push exercise and diet. So I read on, and it just basically said that the taking of blood pressure medications, the diabetes medications, and the cholesterol medications, which both groups would do because it's unethical not to have these people on these medications, it negated the little bit of exercises that they got, or it negated the slight decrease in calorie intake. So you still need to exercise, and you still need to watch your calorie intake if you've got diabetes. And I guess that's it for now. So today we had a kind of diverse show. We talked about Medicare supplemental insurance. We talked about medical ethics in studies and payments to physicians. And last of all, we talked about a few concerning things, that is, studies that say you don't need a physical exam. Well, you do need a physical exam, maybe not as much as you think. Niacin didn't seem to help for heart attacks. Omega-3 fatty acids didn't seem to help for heart attacks. Exercise and diet didn't seem to help prevent heart attacks in diabetics. I hope you enjoyed this show. Hope to see you again next time.